And we are live. It's Dr. J here in the house on YouTube. Again, make sure you smash that bell, hit that like button for great notifications. Also, put your comments down below. Let me know what you guys are thinking. It's been a little while. I'm glad to be back in the saddle again. We're going to do a little live Q&A. I wanted to chat about off the bat is why stress can cause estrogen dominance, right? Estrogen dominance is this relationship of progesterone to estrogen. Typically, there's like this 22, 23, 24 to 1 kind of ratio overall throughout the month. It goes to about 300 to 1 during like day 20, 22 of your cycle, but it's about 25, 26, 25, 23 to 1 progesterone over estrogen, okay? And when that relationship starts to drop, either estrogen starts creeping up and or progesterone drops, we start to see estrogen dominant symptoms. That relationship starts to get more skewed in favor of estrogen. What are those symptoms? Those symptoms could easily be something like breast tenderness, cramping, mood issues. It could be excessive bleeding, longer cycles, back pain, irritability, depression, brain fog, weight gain. All of those things are very possible. Now, progesterone is the progestational hormone. So what happens is the first half of your cycle, you have estrogen, right? Day 2, it kind of ratchets it up. You have FSH that comes up. That triggers a rise in estradiol. And then right around day 10, it kind of peaks out. Then LH starts to come up around day 10 to 12, and then progesterone follows. So when this rise in estrogen and this starts to rise in progesterone, this area here, that's where ovulation is. And the last half of the cycle, this is where we have progesterone start to arch up, and progesterone is the progestational hormone. So if you were to get pregnant, where a sperm comes in, meets the egg around day 15, 16, 17, 18, right in that area, then what starts to happen is the corpus luteum will start making HCG, and the HCG takes the progesterone off the charts, right? Now, when you get stressed, let's kind of look at some of the hormone pathways here. This is a really good guide by Precision Analytics. Let's see if I can not get a glare on there. Okay, so if you look here, right, there's no glare on here now. I want you to focus on this. Here's progesterone. Okay, it's looking maybe backwards here, but that's progesterone. Now, if you follow progesterone, okay, over here, this goes into 7-hydroxyprogesterone, and then 17-hydroxyprogesterone can go right down here. And what's that? Cortisol. So you can see the pathway, right? We have progesterone, which is our progestational hormone. Then we have it go into 17-hydroxyprogesterone, and then we have it go down to cortisol, and then we have free in total. So you can see if we are stressed, those pathways get activated, and we're going to take our progesterone, right, and we're going to shuttle it downstream to make more of our stress hormone. Now, progesterone is important, right, because it also has that fertility aspect. It's going to help balance out our female hormones, which is going to allow us to feel better and maybe have less PMS, maybe have our period just kind of sneak up on us where there's no issue at all. It's also going to help with fertility. Progesterone also is a GABA chloride channel opener. So it opens those GABA chloride channels. What that does is it allows us to feel relaxed, calm down. When you get stressed, it allows you to come back down from stress. So when your female hormone cycle starts to get dysregulated, progesterone starts to get out of balance, it's going to be harder to deal with stress, harder to wind down, harder to sleep. Of course, all of those PMS symptoms are going to occur, breast tenderness, cramping, mood issues. You can start to have some of these perimenopausal symptoms as you get in your 40s, or you start going into a place where you're not having a regular cycle. You may even start to see hot flashes, those kind of things as well, where you're more on the perimenopausal side. And of course, when there's aberrations in progesterone, you're going to have all kinds of different problems as you go into menopause. So menopause is going to cause all kinds of problems as well. So very, very important there. So in general, progesterone is very important for stress and for mood issues and for relaxation. All right, so in general, any questions, feel free and comments. I'll give you guys a chance to come on in. All right, can you talk about nootropics? A little bit off topic. Riley wrote in stopping GI Clear 2 and 4 for a week because of the flu. Is that okay? I'd probably stay on GI Clear 2 and 4. 4 has a lot of olive leaf in there, which is antiviral, so that would definitely help the flu. Intermittent fasting. I want to know what you think about your ratio for women. Should you do it? Well, this is a great topic for today's chat because intermittent fasting could be a stressor on someone that already has hormonal issues. Not eating is actually a stressor because getting nutrition into your body actually helps pathways and hormones and biochemistry run better. Now, if we already have good hormone balance and we're already sleeping good and we're already managing stress well, guess what? Then you may be able to handle intermittent fasting, just like you may be able to handle exercise, right? But if we don't have good hormones, good sleep, relaxation, hot flashes, mood issues, guess what? We may have a stress response with intermittent fasting. So first thing first, if you want to engage in intermittent fasting and you have hormonal issues, just look at doing a 12 by 12. So if you stop eating at 8 p.m. and maybe your first meal is at 8 a.m., that's a really good compromise. And then number two, as you get your hormones better, try it on a non-stressful day. So typically, if you don't work on the weekend, maybe try not eating till 2 o'clock in the afternoon on a Saturday, right? Give that a try where your days may be less stressful. You don't have deadlines and pressures on your back. But I always tell patients, get stable with your mood, your energy, your blood sugar, your digestion. Get stable with those things first. Excellent question, though, Ashley. Okay, does ginger increase or decrease stomach acid? It can increase it. What supplement will help manage prolonged stress? I heard vitamin C depleted with stress. Yeah, so when you have adrenal stress, vitamin C is definitely burnt up because vitamin C is a really important cofactor for adrenal function. That's number one. If you're a female, progesterone helps you deal with stress. And again, progesterone a lot of times gets burnt downstream to make stress hormones when you're under stress. So we could supplementally give progesterone, which could be helpful in a palliative kind of jumpstart way. But we also want to fix what the underlying stress is. There are certain adaptogens that we can use on the female side to help with stress, like maca or a Vitex or ginseng or ashwagandha or luthero. So those can be very, very helpful. Mia writes in, perfect timing, Justin. I have dysmenorrhea, PMDD. Yeah, PMDD is just the extreme PMS, right? The extreme PMS symptoms, vomiting, cramps, missing work. Got to get it under control. Idea is to reduce prostaglandin production a week before period. So like a lot of the prostaglandins are like the prostaglandin 1 and 3 pathways, or I should say more 2 pathways, which are going to drive more inflammation. And if you have a lot of excessive pain, one of the big things we'll do in female hormone patients is we'll make sure the diet's solid, make sure blood sugar is solid, nutrition's good, magnesium's up in your food as well as supplementally. We may add in black currant seed oil, which is great. It's a prostaglandin 1. It supports the 1 and 3 pathways, and that can be really helpful for skin and for cramping as well. And if not, we'll also use cramp bark, and we'll use Vitex, and we'll use progesterone. We'll work on the adrenals. We'll work on blood sugar. A lot of times there can be hidden gut stressors that's not apparent, right? A lot of people aren't going to connect the fact that they may have a gut issue or a gut infection to their female hormones. It's too far apart in most people's intuition. Are there any problems when someone eats a piece of food that their cat just licked? I mean, it just depends. If your cat's an outdoor cat, for sure there could be an issue infection-wise, but I wouldn't make it a habit. If they're indoor cats, probably not as big of a deal, but yeah, definitely not a good habit. I heard adrenal adaptogens can lower blood pressure. Have you seen this? Well, yeah, if your blood pressure is caused by high levels of cortisol and you can modulate the cortisol, yeah, that could definitely have an effect on blood pressure. Sometimes herbs like ashwagandha have magnesium in the herb itself, and that could be very helpful to lower blood pressure too. What would you suggest for mental cramps? Mental cramps, you mean like brain fog? Is that what you mean? Just get the inflammation down. Lots of different vectors, but magnesium is always a good one. I'm a celiac and I had endoscopy 5 years ago. Been gluten-free since, but my weight is still low. I don't handle stress well. Got it. What's your question? If you want to write me a question, let me know. What's the latest treatment for CFO? Well, it just depends. A lot of people don't have a fungal overgrowth in isolation, right? That's like the mistake a lot of people make. Is a lot of times there's multiple different things happening and it's not just one thing in isolation. So if it is just that in isolation, then we address the fungal overgrowth and we fix all the, we go through my 6 R's, right? Remove the bad foods, replace the enzymes, acids, repair the gut lining and hormones, remove the infections, repopulate, reinoculate good bacteria, retest. If not, we have to get a little bit more nuanced. I was considering to take acetylcarnitine to help cognitive function and perhaps have physical benefits as well. Do you have recommendations regarding the supplement dosage pitfalls? Yeah, I mean, I think carnitine's great. If we run an organic acid test, we'll see ethylmalonate, suberate, adipate. These are all markers for increased carnitine need. Carnitine by itself can be great if those pathways are high in demand. If not, I'll do a mitosynergy product that I have over here that has some carnitine in it and a little bit of CoQ10 as well. It really helps the mitochondria. Big fan of that. Is there any truth to hair loss being caused by consuming too much fat? I would doubt that. I don't know what the mechanism is. Fat's going to be really important for hair function along with protein, right? So no, it's going to be sugar and insulin and inflammation, things that pinch off blood flow, things that, when you don't provide good building blocks and you drive up inflammation, it's going to cause a problem. Can oil pulling help with sinuses? Maybe. I mean, it depends, right? If the bacteria in the mouth is moving up the nasal tract, potentially. If not, I'm going to do a nasal flush with saline solution and xylitol. I may add some tiny bit of silver in there. I'm going to use a nasaline or a really good nasal flush to get things down. Any new supplements on my radar? I'm just trying to think here. Nothing specific. I mean, there's always the foundational things. And of course, if someone's deficient in some other supplement over another, some other nutrient over another, of course, that supplement may make a bigger deal to someone. Like someone deficient in magnesium or really needing GABA, that may make a bigger difference for someone else that doesn't need it. So the whole idea of like what supplement may be best, a lot of times also may be specific to what someone needs more than another too. That's really important. Like if someone just has poor digestion, the most important supplement for them outside of fixing whatever the infection is maybe HCl and enzymes. Things that aren't as sexy, right? What are your new thoughts on delayed onset muscle syndrome? I know DOMS from like you lift weights and 48 hours later you're more sore than like right afterwards. I get that. I'm not sure what you mean by the syndrome though. Can excess cell phone use cause adrenal fatigue? I use it a lot. Curious if I'm overstimulating my HPA axis. Screens causing bad periods due to stress on the HPA adrenals. Your thoughts? I mean, it depends, right? Number one, don't keep your phone in your pocket right next to, especially if you're a guy, like in your front pocket next to your genitals. Not good. Don't put it up against your head. I have like a little thing on my hip. So my phone goes in here and it's on my hip, kind of by the back, so that it's like 2 feet away from anything sensitive, right? And there's a lot of muscle in my hip area due to my glutes, so it's going to be less sensitive. If you're not using the phone for a while, put it in airplane mode, and you can always put it on night shift too. I keep it on night shift all the time. Knock the blue light down as much as possible at nighttime. I wear glasses at night when I watch TV or when I'm driving, and I just get blue light filters in my glasses that knock out the blue light, which is nice. I'm at menstrual cramps. Sorry. Suggest on helping painful cramps during cycle. Also suggest on fertility, staying keto, but anything that will naturally help. Yeah, so the menstrual cramps, all the things I mentioned above regarding those herbs. Lastly, I have dark circles under my eyes. Last 2 weeks of my cycle, day 15 to 28, can dark circles be caused from adrenals, iron, gut bugs, candida, contributed to dark underage shiners. So first thing, when I see any shiners under the eyes, that's lymphatic pooling. So your frontal sinuses will pool here. So usually it's something coming in the diet that's driving a food allergenic reaction. So we'll cut those foods out. That's the first thing. Get the foods under control. That makes a big difference. What is the recommended dose for a supplementation for magnesium for women? So it depends. So if we're just talking about magnesium generally, we may do something more absorbed like a glycinate or a malate, or maybe a cheaper version like a citrate. And usually it's going to be something that's just under, with the malate and glycinate, maybe 1 to 400 milligrams. With the citrate, we can go a little bit higher, 500 milligrams to a gram. It just depends. With the citrate, you may want to go just below bowel tolerance, meaning you taper it up till your bowels get loose and then back off. Or with a malate or glycinate, you're not going to have that bowel stimulation, so you may just want to do a malate and a glycinate at 1 to 400 and just kind of see how you feel. Your question, Ashley wrote, I try to go low carb and began having extreme anxiety and nightmares. I'm not able to break down glycogen into glucose, and my adrenals are secreting too much cortisol. It's hard to say. It really is. So number one, if you go low carb, you also have to make sure you are getting enough fat. That's one of the big mistakes a lot of people make. Number two, people that tend to have a problem going lower carb, Longer term are people that are already, like, they're more ectomorphic. They're already skinnier, leaner to begin with. They may need more carbohydrates. So if that's not you, make sure you are getting enough calories. Make sure there's enough fat there as well. And there may be, a couple of week transition for those enzymes, for those lipolytic, hormone-sensitive lipase enzymes to increase and start breaking down fat better for fuel. Again, the goal is to break down more fat. So if your metabolic machinery isn't adapted yet, it may still be relying on that glycogen and it's not quite transitioned over. So we're trying to give you like a metabolic engine transplant. Okay. Does EDTA move healthy metals too? It can. It has a primary affinity to lead. Can fibromyalgia be improved by hormone balance? Yes, definitely can. Just also fixing inflammation in your body via foods, stress, not over-exercising, definitely can. Low thyroid can also drive fibromyalgia too. Female, keto, lots of sneezing, runny nose when exercising. Is this an adrenal issue, stress issue? I feel great exercising, but sinuses definitely go crazy. So it sounds like this is only happening when you're exercising. So it could be an adrenal issue. I'd want to see where your adrenals and your hormones sit. I'd also want to know kind of what's that minimal dose that you can put yourself under without having those symptoms. I would start from there and then work your way up. I was told that there was complete villus atrophy. Should it be healed or regrown by now? I was drinking aloe, glutamine briefly over a year. So villus atrophy is typically going to be caused by celiac. So did you fix the problem? Did you cut the food out? Was there any infections? Did you work on good bacteria? All that stuff. You wouldn't, like, if we look at like the third R, which is like repairing the gut lining and the hormones, if you just like repair the gut lining, meaning giving aloe and glutamine and all those good healing, soothing nutrients, glycine, it may be very helpful, but it may not fix the issue if there's inflammatory food or if there's infections or there's bad bacteria imbalance. So you may want to look at those other factors too. Margaretha writes in, GABA makes me sleep so well. Could I get addicted to it in a way so I have to take it to sleep? GABA is a nutrient. It's an amino acid, so I'm not worried about it from an addiction standpoint. Maybe if you're trying to bump it up using Phenibut, that's a little bit more addicting, but GABA, especially, if you increase it with theanine too, I'm not worried about that. Larry writes in, what can cause a sense of stomach fullness and a mild stomach pain? Also got some bloating. I have a SIBO test coming back negative. H. pylori came back negative. Not sure what else to do. Not sure what labs you did. And so in my clinic, I would run the GI map as well, maybe even a breath test. But if you did the breath test and that came back clean, we worked through the 6 R's. Remove the bad foods, replace the enzymes, repair the gut lining and the hormones, remove the infections, repopulate good bacteria, retest. And it just depends. I don't know where your diet is. I don't know where those first 2 to 3 hours have lined up so far. Okay, excellent. Great questions, y'all. Let me just find my next question. Makes perfect sense. Food allergens plus sinuses. I notice when I eat processed sugar, it acts up. Yeah, exactly. So get that worked on. And you can also flush out the sinuses with the nasal flush too. Does gut issues like leaky gut / candida contribute to insulin resistance? It can. It can contribute to insulin resistance because leaky gut and candida can drive inflammation. Inflammation can stimulate cortisol because cortisol is coming to the table to put the inflammation down. Cortisol then mobilizes more glucose, and then glucose would then stimulate insulin. So you see how that all lines up there? Luke writes in, my mother-in-law went to India, got really sick over there, gastrointestinal bugs. She got better but lost a lot of weight over the following months and got weaker. Her conventional doc doesn't know what to do. Stool testing came back negative, which the way you take SIBO hydrogen sulfide, it's different, other types of SIBO. So in general, I would definitely run a GI map stool test. If you go to my site, justinhealth.com/shop, go to lab test section, you can find it. But more than likely, there's an infection there, and we have to work through those 6 R's, okay? Remove bad foods, replace enzymes, acids, repair gut lining, hormones, remove infections, repopulate gut bacteria, retest. Lambert writes in, which way would you take SIBO hydrogen sulfide to differentiate other types of SIBO? Not sure your question, but there's hydrogen sulfide tests out. They're not super accurate yet, though. Jack writes in, natural remedies for migraine and tension headaches. So it just depends. There's lots of different causes. That's the problem. So people are like, what's a natural cure for this? Well, it depends on what the root cause is, right? Headache, migraines could be caused by gluten in grains. It could be caused by blood sugar issues. It could be hormonally based. It could be excess inflammation driving it. It could be structurally based because of poor posture. So there's a lot of different causes. So I would need a lot more info, but all those things I mentioned would be possible remedies depending on what the cause is. Hey, Dr. J, 6 months back, I got rid of leaky gut, indigestion, and constipation by using ACV and bile salts. Yeah, that first R is removing the bad food. Second R is replacing enzymes and acids and bile salts if needed. And yeah, so you hit those first 2 R's, and sometimes that can move the needle significantly. Congrats. Mia wrote in, what food sensitivities, what would a food sensitivity test help, or just do a simple elimination? I like to do simple elimination to start. If people are really good on their diet and they're awesome and they're doing great, then maybe we look at a food sensitivity after the fact. I just recommend whatever you love, rotate it, because the foods you eat the most frequently tend to come back with the food sensitivity. So then it just becomes a waste of time and money, because it's just like whatever you eat is the issue. And there's different tests that are better. Like MRT is really good for food. So is ELISA's decent. The ELISA Act is really good too. And then there's one more big one. I forget what it is. ALCAT. See here. I take bile salts, enzymes, lipase, and eat healthy, fats, and stool. And I have stool. And stool have fat in my... Okay, got it. Broken English. All right, what's the problem? So if you have fat in your stool, it's the 6 R's, right? So when people come in with gut issues, I'm like a broken record. I create systems just kind of like, that way it's impossible for me to miss something. So I always go to the 6 R's. Now, when you go to the 6 R's, could the second R be more important than the third R, or the fourth R be the most important than the first R, right? It's always possible, right? But you don't know that. And so we make changes, we implement, we execute, we follow up, we review. And then that's how we get the best results, all right? Typically, when we're moving physiology and moving biochemistry, there's a lot of levers that we want to do. And part of doing anything is doing it in the right order to get the best results. And also setting up the foundation so the next step, the next lever we move is going to have the best chance of being successful and not create more issues, i.e. when you kill infections, it can create more stress. Do catalase supplements really help to reverse gray hair? So there's pseudocatalase for like the skin issues, right? For hypopigmentation. But for the hair, I mean, glutathione is going to be one of your best things. Selenium, because those are going to help. Hydrogen peroxide, which is going to happen when catalase is low, which is going to cause more graying. But glutathione's great. Selenium's great. Things like zinc are going to be great. I did a video on this, I think, last month. Take a look at that. How do you remove heavy metals specifically from your brain? So you can do things like ALA, DMPS. Of course, some of the binders are great. So if you pull the heavy metals out, you're able to kind of bind it up. Okay. So bentonite clay, fulvic minerals, zeolites, activated charcoal, all good. Jay Smith writes in, 2 weeks back, I started bloating, indigestion, constipation 3 days straight. Okay, got it. No question. Sorry, I meant to. How do you tackle hydrogen sulfide different to hydrogen methane? It just depends. It just depends what we've already done. I typically rotate in different herbs. It all depends on what we've already done before that. What's worked and what hasn't. Breen writes in, I face issues focusing on trying to absorb information in classes faster, which makes me less productive. I was thinking that it could be ADHD. What do you think? Is there any natural remedies? ADHD is nothing more than stating the effect, right? So a lot of diagnoses are literally just stating the effect. It's like, I have knee pain. Oh, yes, I'm going to diagnose you with arthritis. So arthritis just literally means inflammation of the joint. It's like, no crap, of course. Like inflammation in the joint will manifest with pain there, right? So conventional medicine is literally brainwash people into thinking. They literally give you a diagnosis that usually means that there's an issue in this area, but you're already going into them saying, hey, I think there's an issue in this area, and then they just say it back to you in a different way that sounds more professional, but means the exact same thing. So instead of asking for a description of the effect, which is what they're saying, is the question always goes, what's the cause? And you can never say, hey, this is a cure for this when there's multiple different causes for it. That's the problem with it. So with ADHD, of course, it's going to be food quality, dyes, sugar, grains, Lots of good healthy proteins, lots of good omega-3 fats, lots of good blood sugar stability kind of support. And then from there, you can do things like tyrosine and B vitamins and ashwagandha, and you can do maybe paracetam and certain nutrients. If there's gut infections or gut inflammation, that can play a role too, because inflammation in the gut can create inflammation in the brain. And of course, low magnesium, low B6, tyrosine, 5-HTP. I mean, there's so many different things. So, you never just go into one thing. There's always a hierarchical thing in how we start, and it just depends where that patient is. So if your diet's not good, or there's inflammation in the gut, we start there. Is colloidal silver effective for gut bugs and candida? It's helpful. I would never just use it by itself. Can MSM really help with the skin? I mean, it's a sulfur, methyl sulfonyl methane, right? But my favorite thing for the skin is going to be collagen. Collagen's going to be my favorite. It's good for skin, hair, and nails. Matthew writes in, what foods to add or avoid when trying to detect H. pylori naturally? Defast, I think you mean detect. Nothing, I wouldn't do anything. Just a typical, really good diet is a great starting point. All right, any last questions, y'all? Let me check Facebook real quick. Any questions over here? What's a sign of not being able to lose weight regardless of diet and exercise? Hold weight around midsection. So number one, it just depends, right? So first things first is going to be looking at your macros. So if your macros are good, or if you're on a kind of a keto template and you've been keto for a while and your carbs are less than 10%, your fat 60 to 80%, and your proteins 15 to 25%, fine, that's great. You may want to look at starting to increase the carbohydrate. If your exercise is good and you're not over-exercising and you're doing good resistance training or interval training, that's awesome. We may want to look at retesting the thyroid. I want to know what other symptoms are there. Is there fatigue issues? Is there sleep issues? Is there mood issues? Are there gut issues? Because, of course, we want to fix those hormonal issues. But, of course, the gut and the thyroid are going to be key. And then after that, potentially adding in things like intermittent fasting if we need on top of that. But just make sure you're stable. There's a progression in how I work to that. Okay, excellent. If somebody was infected by herpes simplex, how would you go about addressing it? So herpes simplex, I'm pretty sure that's herpes 1, right? That's going to be oral herpes. That's like your typical cold sore. So we're going to fix the triggers, and a lot of times it's some level of stress, poor diet issues, sleep. It's going to cause it to express itself, right? So we decrease the amount of time it expresses itself. Number one. And then number two, we're going to do things like natural antivirals. We'll do high-dose vitamin C. We could do high-dose L-lysine. We could do reishi mushroom. We could do monolaurin. We could do olive leaf. These are all really, really, really good options. What's for lunch or dinner today? So today is just, breakfast is usually 20 grams of collagen, butter, MCT. Yesterday's lunch, I did a shepherd's pie. Instead of potatoes, I had mashed cauliflower. So mashed cauliflower, carrots, peas, and then some grass-fed meat. And I'll have that. I've been liking the Autumn Gold bars by Costco. They're nice. They're just like some nuts and seeds and a little bit of honey and maple syrup in there, like 4 grams of sugar. Not too bad overall. So I like those for a little snack. I may do like a keto cup or two, which are great, like less than 1 gram of sugar, dark chocolate, coconut oil, and then usually some kind of a kombucha. Tonight, I'm going out to eat, probably have a nice steak, something like that. Usually I'll carb up a little more on the weekend. I'll have like some mashed potatoes. I try to keep carbs relatively lower during the week. If I'm not exercising, I keep them lower. I exercise more, lifting more weights. I'll do more carbs because my muscles are more drained and I can soak up more glucose. Yeah, Kim, you're totally welcome. For Western blot Lyme, if 3 bands came back present, but both sections were negative, is there anything alarming there? So it depends. Are we talking IgG or IgM? I'm guessing IgG. So the CDC says 5 bands, right? The alternative diagnosis is 3. I'm guessing no IgM. So it just depends. I would also want to look at the ELISA or PCR on the Lyme. I want to know where your symptoms are at. I typically don't go after Lyme right away because a lot of times the immune system is going to be stressed with other gut issues. So I always work through all the hormones, diet, gut infections, and that tends to significantly improve the immune function and makes it easier for your body to deal with and process the Lyme. But if it is, there are some formulas out there by Beyond Balance or Nutrimedica that I'll use to knock it down more or support it more. Like an easy one is like Banderol, or we'll do Banderol excellent, we'll do like a high dose cat's claw or cemento. Those are really good low hanging fruit. Work with a good doctor on that, because if you start feeling worse, there's a hierarchy in how you should deal with that, right? Do you recommend eating FODMAPs while trying to kill SIBO bacteria? Yes, to tolerance. Don't overly do it so you feel like crap, but adding a little bit in there can act like cheese on the mousetrap and kind of bait critters out. So I like that. All right, y'all, I'm going to get another video here going in a few minutes. If you're liking this, give me a share. Put your comments down below. Let me know what you think. If you have any great ideas for video topics, put your comments below in the chat too. Really curious to know what you think. 2 more questions. I'll answer it, and then we'll gotta run. I tried college in my morning coffee. It makes me sweaty, anxious, brain swings. Heard it's glutamine. Alternatives for collagen. Yeah, it could be that. I've seen patients when I fixed their gut, they can handle collagen better, but it could be the glutamine going to glutamate. Very possible. I'd fix the gut and then come back and see what happens. And then just kind of start low, maybe at a 1/4 teaspoon, and just kind of work up from there. ANA has been positive for years. Zonulin off the charts as well. Yeah, so go to the 6 R's, right? Remove the bad foods, replace enzymes, acids, digestive support, repair gut lining, and hormones, remove infections, repopulate, reinoculate good bacteria, retest. You should work with a good doctor on that if you've been struggling. All right, y'all. Hope you had a great time and enjoyed the show, and I will be back soon. Appreciate it. Take care, y'all.